presidential approval.
Yep.
Good morning, Dr Tay, and thank you very much for providing us with this opportunity to get an insight into your work. I'd just like to ask you, what is your role in supporting Professor Marshall's work in Helicobacter?
So I'm a DNA genomic analyst. I look into the evolution of Helicobacter, how they evolved, and Barry Marshall needs me to look into this. And he's a very busy man. He doesn't have time to look after the patients. So we do see patients every month, and so it's my job to look into the patient's Helicobacter, and we do antibiotic sensitivity tests to make sure that the drug we prescribe to the patients are effective, and they'll be cured.
So how do you get the patients originally? So are these people that are diagnosed with ulcers and then they come to you, or do you actually have like an experimental group where people volunteer to come in and have the work done?
So these patients are all patients who failed multiple times with the standard therapies outside, and they have no other ways to cure. The GPs outside has no other ways to cure these patients. So they refer them to us, and then we put them into a waiting list, and then when it's their time, we do endoscopy, and then we collect biopsies from them, and then that's how we get the patients.
And then you start administering, is it one particular drug that you use, or are you using different drugs?
Yes, we test them with multiple antibiotics, six or seven antibiotics, and then we'll find the one that has the lowest side effects and has the highest cure rate. So we recently published a paper about these combinations of treatments, because the current standard therapies is failing because of people abusing antibiotics, especially in the Asian countries, and we have lots of migrants from these countries. So these people brought in the resistant strains, and probably a new types of treatment plans is needed. In Europe, the standard therapy has been criticized, that it's not useful anymore because the failing rate is greater than 70% now. So a new treatment plan is needed.
And what time frame do you administer the antibiotics?
10 days.
10 days. And what's your success rate in terms of curing the ulcers?
95%.
95%.
Yes.
So what do you do with the 5%?
We try a different treatment plan. Where is here?
Yeah, that'll do. That's fine.